If you're rolling across the dial and you have stopped on us, just stop right here. Be still. You need to hear what we're going to talk about next, because we can give you some clues and some information that can make your Buncombe life better. And that's what you've joined, Buncombe Life. Thanks for joining us. I want to tell you that if you've ever used the Board of Election or Election Services, you need to know that they have moved. Believe it or not, they've been in the same location since 1972, and I'm looking at it across the street, the courthouse annex. But now they've moved to what's behind me, what used to be Buncombe County Health Center. It's now referred to as 35 Woodfin Street. And I'm joined today by Mandy Stone, who is the Director of Social Services and the Assistant County Manager for Buncombe County, correct?
Correct.
Okay.
Good morning.
Good morning. And we're going to talk about some interesting things that are happening in Buncombe County, and it involves moves and changes and good things. A lot of that involves what's behind us, 35 Woodfin Street, that for years, I don't even know how long this has been the health center. Do you?
Since I came to work.
Since I came
30 years ago.
Me too. My whole life. Dr. Tenney used to be our health director. It was always here. It's always been the health center. Not anymore. There are a few health services still left here, but eventually all that will change. But what we want to talk to you about today is what has moved out and some things that we've done to make things better. It really is making Buncombe County better. Tell us what has moved out and what's kind of going on with all these health services.
I think the focus has been trying to align services in a way that are easy for citizens. I think the commissioners have been very driven by can we make it easier for citizens to access services, and how can we improve efficiency. So trying to move like services together.
Right.
Just plain old logical sense. So in terms of health services, the first partnership we did, which is now the Minnie Jones Health Clinic at 257 Biltmore, moved to all of primary care. Okay. So that's where all of our primary care services sit at 257 Biltmore.
And what is, for folks at home, because I know for years I didn't know, I would hear y'all say primary care. What is that?
Well, in the actual model that we purchased in this contract, it includes actual primary care, includes acute, episodic sick care walk-in, dental, mental health, behavioral health, and pharmacy. So these are all integrated in one site.
So these are folks that normally would have gotten care at the health center.
Yes.
And now they still get care. The county has just contracted that care out.
We contracted that care out. We had reached a point where we saw as many as 300 people a day a month unable to access services. So we knew we had to do something to expand services.
So stop right there. You're saying 300 people a day trying to come here to the health center that couldn't get
appointments.
Just couldn't get care.
Could not get care. The commissioners decided we need to look at a different model that would increase access to citizens, knowing that many citizens are challenged in this economy.
Well, exactly, and that's what I think is so neat about what they're doing. And you and I've been here with the county a long time. This is, I wouldn't say the first thing I've seen that made sense, because they've done a lot of things that made sense. But this totally makes common sense.
It does make common sense.
Because it brings services together. It meets those 300 people that couldn't get care, now are getting care.
Absolutely. And it was less expensive for the taxpayers, and the commissioners were very focused on not putting additional burden on our taxpayers. So for about half the money, we actually were able to purchase more care, and in the first 6 months of operation have seen more people through the new model than we saw in a year at the old health center.
Because if you've watched the show, you've heard us talk about this before. We talked about in January this was going to begin transitioning. That transitioning, like you said, is now about 6 months old. And it's working.
It's working. It's working very well. Okay. You know, we added close to 100 walk-in acute episodic visits a day, which we had no capacity for that in our clinic, and then about double the client or patient capacity.
So you say episodic visit, that means I don't have an appointment, but I'm sick and I need care.
Sore throat, earache, I'm sick, my child's sick, the ability to just walk in and access that care.
Now, who are these people? These are people who are low income or no income, or who are these folks?
They are people who are low income or no income, and they're screened. That's another component that the commissioners really were invested in. This is what's called a community health center, which is a federal model, but a big piece of it is about individual responsibility, meaning if I come and present that I'm unable to pay, we should verify I really don't have the capacity to pay, and I should still contribute to the extent I'm able.
Right.
I might not be able to pay the full cost, but I need to have some investment in my own health care. So that's the national model that this is built on.
So, and that's getting these people into that care. And I know we're going to put on the screen the different locations.
Yes.
But 257 has a special name.
The Minnie Jones Health Clinic.
The Minnie Jones Health
Clinic. Minnie Jones was the founding member of the organization we're contracting with, Western North Carolina Community Health Center.
So that foundation actually started here. This is not big corporate that came in to take over. This is a local Western North Carolina Community Health Clinic, Winches. You'll hear people say that, Winches. That's what that stands for.
Yes.
That runs, essentially you privatized what was happening here.
We privatized. And actually, at the time we made the switch, we were about 3 times larger than Winches. But if you watch what's happening on a national level, while there are many issues that are controversial, what is clear is that community health centers will be the entity that delivers care to un- and underinsured. So moving in this direction really aligned us well for what's coming on a federal level.
So in all that federal government health realignment, we're setting good to be able to get those
You're
funds.
perfectly aligned for that.
If we had not done that, our health center would not have been setting well.
Absolutely. No, they would not have been eligible for the way that the funds are being driven down. And the way the federal government approaches that is they give community health centers enhanced reimbursement for Medicaid and Medicare so they can see people with no coverage. Allows them to see people with no coverage. And then they allow them to buy pharmaceuticals in bulk at a reduced cost.
Right.
That change alone was about $250,000 less than we were paying for the same drugs for the same patients when we had it in-house.
Just with realigning.
Just with realigning.
And some places have not done this. And if we had not done this, had not been forward thinking to do this, we could still be running this, but it would be costing us, Buncombe County citizens,
Twice as much.
For the same thing.
Half the number of people.
Good point. Not seeing as many people and it costing more.
Absolutely.
That's crazy. I mean, if you can get this, and this is complicated. It is
very
complicated.
complicated.
But I just want the folks at home to realize that this took a lot of planning and a lot of shifting.
About 3 years.
3 years of planning and shifting. And we haven't stopped. You're still looking forward, still tweaking the model.
Absolutely. And it's a performance-based contract, so we're measuring not only the number of individuals they see, but we're also looking at the outcomes for those individuals, and we're looking at how frequently those individuals have to use the emergency department or are hospitalized. So we're tracking all components of that.
Now, how about customer service? Are you tracking customer service?
We are tracking customer service. In the beginning, I actually took all of those calls myself, and there were not that many given the scope of the transition. But they're focused, and we're focused very, very heavily on, are we delivering what the citizens want the way we want?
Right.
Now, I'll be honest, I think access to health care across the nation is so tight that not everybody can get everything they want as quickly as they want, but we're certainly delivering more than most communities.
And delivering more than you were at one time.
Absolutely.
In a better way.
We believe that.
Okay.
We feel very good about that.
You should feel good about that. This has been complicated. We're going to talk to some more folks about this.
Sure.
I want to go over and talk with the doctor at
Polly Ross, their medical director.
And so stay tuned for that. Before I end up with you, I want to talk just for a second because you're assistant county manager.
Yes.
And I did start by telling you that the Board of Elections has moved here to 35 Woodfin Street, which it still says Buncombe County Health Center, and by the time you watch this, that may be gone. Because this won't be a health center anymore. It's going to house a Board of Elections, which it does now. It's eventually going to house our tax office. It's eventually going to house Register of Deeds. It's eventually
going to house child support and the social work divisions of DSS, which are engaged in the court system every day. So there are a lot of efficiency gained by moving that staff and those services in the court corridor.
Like a judicial center.
That's a judicial center.
And an administrative center, so it's all right here, and this is a beautiful area for folks to come to. Parking deck, right here.
Right there.
Where you've got parking to come to. And I just bring that up, and we're going to hit that more next month and give you more detail about that. I just wanted to hit that because that's where the county's headed. Getting more, and that's what I said, in our almost 30 years here.
That's right.
This makes so much common sense. To put things together so you don't have to run all over creation to get the services. And I think your shop over at 40 Cox is going to be wonderful when it's finished. Not there yet. When it's finished, you can come in for services, and whether you need health, social services, some kind of financial service, one intake, one person.
That's right. You'll be screened for any service going through one intake. And if you look on any given day between health and DSS, about 70% of the people they're serving are the same people. So it makes all kinds of sense for citizens, and that's clearly what Commissioner said.
That's right.
Just make sense about how we deliver services for our citizens.
Yeah, and it's going to be a little rocky here in the next year, getting it all together. You may show up at one place and find out you've got to go somewhere else. But looking, as we always do, a year, 2 years down the road to the vision, begin with the end in mind. Where this is going, you're really going to love it.
It's going to be great.
I think it is going to be
great. We're going to have so many efficiencies by being able to share functions like mailroom and call centers that both help the citizens and then our best use of taxpayer money.
That's
so
exactly
it's a win-win.
Right. Hopefully we can keep the tax rate down and it won't be so painful till we get through these terrible times. Thank you, Mindy, for joining me.
It's great to join you.
And you stay tuned.
You may know one of the biggest drug dealers in our community.
This drug dealer is supplying prescription medicine to the kids in our local schools.
Studies show that 1 in 5 teens have experienced prescription drugs. These drugs are the prescription medicine that's in everyone's home.
It can be medicine for pain relief, depression, muscle relaxers, allergies, or simply cough and cold medicines.
There are a few things you can do to keep these drugs out of kids' hands. Monitor your medicine. Count the pills on a regular basis.
Don't keep the medicines where teens can find them. Keep them in a controlled area. Please be responsible for your prescription medicines.
And help keep them out of our schools.
Welcome back. I'm here at Western North Carolina Community Health Services at 257 Biltmore Avenue. Don't let me mess that up. 257 Biltmore with Dr. Holly Ross, correct?
Correct.
Medical Director. And we were just talking to Mandy about the transition from all the health services that used to be primary care that was at the health center, and it's been there for years.
Right.
Has now moved, and those services are not at the health center anymore. Immunizations is still there. We're going to come back later and tell you what is still at the health center. But the primary care has moved here. And you are the Medical Director for WINCHES. You're going to hear us say that. That's Western North Carolina Community Health Services. WINCHES, that's what that is. 257 Biltmore. You're the director here. Okay.
That's correct.
And I was just asking her a few minutes ago, I said, how long have you been with WINCHES? And you said...
And I said a long time.
You said a long time.
That's right. We actually became incorporated in 1993, and I started in 1996. So 16 years. Right.
16 years. And when she said that, I went, oh, because even I thought WINCHES was a new thing, and I should have known better. I should have known better.
We've been around in the community for quite a long time.
Yeah.
And we were originally founded to bring more resources and access, more money, more dollars to Buncombe County.
Not really competing with the health clinic at all, but just helping.
Another structure that would bring healthcare dollars into Buncombe County.
Right.
And so a couple years ago, the county and us at WINCHES, decided that perhaps we could be more resourceful if we worked together.
Right.
And that's how this brainstorm started.
Right. And Mandy explained a little bit of that when we talked to her a few minutes ago. It pulls down more money from the government.
Exactly.
You're able to see more patients.
More patients, and hopefully serve them better.
That's exactly right. Y'all are having an open house today. We're going to get in there in a few minutes, and you'll see it's great.
It's a beautiful building.
It is a beautiful building. So you are able to see more people.
Yes. We operate a walk-in urgent care. It's not fast clinic, but it is a same-day clinic.
Right.
And then we also have scheduled medical appointments for both adults and children.
Right.
We're really interested in our children and want to serve kids and do their well child checks.
Yeah.
And so we want to be everybody's primary care home.
I love that. So if somebody's sitting at home and they're going, I don't have a doctor, I don't have health insurance, I don't know who could help me.
We're their spot. That's our perfect patient.
And I'm telling you, I was just in there, I wouldn't mind at all. I mean, it's really nice. It really is. I was very impressed.
Thank you.
Okay. So who are some of the folks that you see? Maybe people that used to have health insurance. Some people still do have health insurance.
We don't want to be a myth that we don't take insurance. We'll take some insurance.
Right.
We'll take your Medicaid.
Okay.
We'll take your Medicare. We'll take you if you don't have anything. If you're self-pay, we waive the fee to be seen by the provider. We ask everyone to help with their prescriptions. If you have no resources, we work with a social worker. So we're really about affordability and access.
Cool. And you don't, if somebody comes in there and y'all cannot help them, you may forward them to somebody who can.
We'll try our best to get their needs met.
I love that. So, and this is what I really want people at home to know is you guys just didn't start up in January when it all started transitioning. You guys have been doing this, helping the community, working in the community for a long time.
Yes. In fact, we've been doing primary community neighborhood care since the middle of this decade, 2005.
What neighborhood?
In West Asheville.
In West Asheville.
The neediest neighborhood, perhaps.
Absolutely. Grew up in West Asheville.
There you go.
I can testify. I know. And I know that today they're going to be naming this facility the Minnie Jones Health Center.
Minnie Jones Family Health Center.
Minnie Jones Family Health Center. Who is Minnie Jones?
Minnie Jones is a wonderful woman.
She is.
You know, she has been in Asheville for many years, probably 40 to 50 years.
Yeah.
And really a leader when it comes to having all folks be respected.
Yeah.
She is a human rights advocate.
Yeah. I love Minnie. You can't say no to Minnie.
No, you cannot.
So, because, thank goodness, people couldn't say no to Minnie.
Look at all the
Look
good
what
that has
we've
been
got.
done. Look at all the good that's been done.
That's exactly right. So, but she started in her community. She didn't go out and start telling other people how to do it. She started in her community.
She worked in Pisgah View, integrated Pisgah View Public Housing Project, has been working with HIV/AIDS, has been working with the poor people in West Asheville and the Housing Authority, and everywhere that good needs to be done, Minnie shows up.
Right. Oh, that is so cool. And you guys are doing great work here. Is there anything before we finish up that you want folks at home to know about Winches or about 257? And y'all have other locations as well.
This is our main location. We do have mental health services in West Asheville still. We have a full pharmacy here. We do ask that if folks get their prescriptions here that they give us 48 hours notice, just so we can get it all done for them and they don't have to wait. That really helps us a lot. And we don't want to hold them up. We know it's hard for them to get over here sometimes if they have to get a ride or take the bus.
And if people at home are confused about the move or confused about Winches or think they need it or somebody else needs it, they can just call.
They can just call.
And we will put that information on the screen.
Great.
Thank you, Dr. Ross.
So nice to talk to you.
Yeah, it's great. Thank you. Stay tuned. We're not done.
Hey, Dad. I know bird flu is quite rare in humans, but could that change if the virus changes?
Need some answers? Find them at pandemicflu.gov. A message from HHS.
Glad you stayed tuned. We're going to finish this segment out. I'm still here at 257. We got out of the sun a little bit. Feels better over here, doesn't it?
Indeed he does.
With Curtis Venable. He is the board chair of Winches. There's that word again. I'm so glad I finally learned what it meant. For a long time it bothered me, I just have to say. Western North Carolina Community Health Services. See, I still have trouble. But that you'll hear Winches, and you hear it everywhere now, but for a while I thought, who are they talking about?
Except for me, I'm going to say WNC Community Health.
I like that better, I really do.
It's okay. I always say WNC Community Health.
This is Curtis Venable. You are the board chair.
Yes.
For WNC Community Health. Okay. And we've talked about, the folks at home have watched Mandy Stone, who's Assistant County Manager, tell us about this great collaboration and why. And then Dr. Ross told us, and she's frontline with the patients, and I'm just impressed, like I said, with what's going on here. You were part of bringing this collaboration together. Why?
Well, you know, as the others have talked about, as Ms. Stone was talking about and Dr. Ross was talking about, I mean, the important thing was the partnership. And folks with WNC Community Health several years ago and folks with Buncombe County several years ago realizing, well, WNC Community Health was doing something, and Buncombe County, through its fine staff with the health department, were doing something. But in isolation, it didn't make as much sense as trying to combine things. And through the support of Buncombe County and several other community leaders, WNC Community Health was able to achieve its federally qualifying health status, which has all kind of benefits for our community, most importantly being better reimbursement, a little bit extra money for uncompensated care individuals. And that's something that really neither WNC Community Health nor the county on their own probably could have achieved. But working in partnership, that managed WNC Community Health getting that federally qualifying status was the first step in this. And then after that, it became real clear, as folks have talked about, that at the end of the day, WNC Community Health, through its unique status, its ability for better reimbursement, was a better deal for the citizens of Buncombe County to partner on. That the County of Buncombe could effectively buy services for many of its indigent citizens here in the county through WNC Community Health at a rate that was actually better than what they themselves could deliver in terms of cost, not necessarily in terms of quality. And in fact, after the merger occurred, a lot of the previous staff who had been with the health center came on board here at WNC Community Health so as to ensure the continuity of care for all those former patients that had been at the health department that came in as part of the partnership deal here with WNC.
So what I hear you saying for folks at home, a lot of big words, but what you really said is tax dollars that they're paying, I'm paying, you're paying,
yeah,
we live here,
paying, exactly.
We're all paying.
Exactly.
Tax dollars coming into the county that used to be spent at the health center are now, they're still being spent, but they're being spent with Western
WNC Community Health.
There you go, WNC Community Health. But those same dollars are buying more and seeing more people.
The bottom line is, for the taxpayers of Buncombe County, more folks are being seen for less cost. Less cost in the absolute sense, and in terms of the per patient cost on both senses, so that at the end of the day, Buncombe County can redeploy some of the funds that had been spent on pure patient care toward other public health initiatives like additional staff, health staff in the schools, or other preventive health measures inside the health department. The bottom line is, at the end of the day, there's more services for the citizens of Buncombe County with absolutely no additional cost to the county taxpayers.
That is a win-win of supreme order.
Absolutely, which again was the why folks at WNC Community Health and the County of Buncombe several years ago, 4 or 5 years ago, when folks were at the very beginning of these conversations as to what steps can we take, the goal was never about how do we take money out of the system. The whole goal was about, let's grow what we have utilizing other resources. Let's bring additional resources to Buncombe County.
Without having to spend any more.
Without having to spend any more, so that at the end of the day, as folks will see in terms of the facility here and the staff here at WNC Community Health, high quality care for less cost to the taxpayers of Buncombe County.
Right. And I know a few years ago, indigent care was a looming darkness on the horizon because there were so many indigent care into the emergency rooms and all that stuff. And I know we were just scared about it, but then this came along and it said this is one way.
Well, let me be real careful. I always, when people start, indigent care is still a big dark cloud, and this doesn't resolve that at all. This is just a piece of many solutions that Buncombe County, in contrast to many counties in North Carolina that just sort of threw up their hands or walked away from it,
right.
Buncombe County has taken its limited amount of dollars that it's always been spending for a number of years and decided, let's figure out how we can spend them smarter, wiser, and expand the scope of coverage we can deliver for some of our indigent residents. We can't cover them all. That's impossible. Nobody in the world can do that.
Right.
You know, the United States government hasn't figured out how to do that. But at the end of the day, what Buncombe and its leaders have figured out how to do is how to cover more people with at least as good or even better care than delivered before with less cost.
Optimum number of people.
Absolutely. And that's what everybody's always aiming for.
That's exactly. Okay. We talked about Minnie Jones. Minnie Jones began this a long time ago. And they say, what can I do? I'm just one person. Well, if you're one person with a dream and a passion like Minnie, look what happened.
And exactly right. And look at all the people that can be helped when folks partner together on a simple idea, and it multiplies out across time.
Right.
Exactly.
And y'all didn't keep your little ball over here and say, this is what we're doing. And Buncombe County didn't say, we're going to fight them and we're going to compete over here. We pooled resources.
And it was all, as I said, it's all about the partnership and what folks can do in a positive sense when they think outside their original box and when they think about, this is not about my turf, but it's about our citizens, and what can we do to help our citizens for less cost.
Right. And I just have to say, Buncombe County does that, not just here, but in all over the place. We really do try to think of the citizen first.
Exactly. And that's because at the end of the day, what's the purpose of government anyway?
That's exactly right. Amen.
Hallelujah.
And I think that's the last word. Thank you, Curtis.
You're very well. Happy to be with you.
Thank you. And thank you for joining us. Stay tuned just a little longer.
Grandpa?
Yeah.
I know bird flu is quite rare in humans, but could that change if the virus changes? Do the experts expect bird flu to have global ramifications? Should we be taking precautionary measures in case bird flu becomes a pandemic?
Need some answers? Find them at pandemicflu.gov. Learn what you should have on hand in case pandemic flu should occur. Learn what healthy habits you and your family should be practicing right now. And find out who you should be talking to about pandemic planning in your community.
I guess it would be prudent to be prepared.
It's time to know what to do about pandemic flu. Visit pandemicflu.gov or call 1-800-CDC-INFO today. A message from HHS.
Hope you've enjoyed this episode of Buncombe Life. I've learned a lot. I've enjoyed talking to the folks. Glad you stayed with us though, because I want to give you an update on Christmas in July. Remember that? We collected all that stuff for the troops to send to Operation Care Package? Well, thank you, because you gave us supplies, and we collected 112 boxes full, and the boxes were big. They were big, high boxes full. We put that on 14 pallets and shipped it off. It's on its way to Illinois. So hopefully when Christmas comes around and you're opening your presents, you can know that you help troops have some special packages to open too, and they'll be enjoying all that good stuff. It was really heartwarming and overwhelming to get to be a part of that. So thank you for that. I also want to let you know that we talked about earlier in this show, if you were watching, that the Board of Elections has now relocated in here in the 35 Woodfin Street, Department of Health, but the Department of Health is moving out. Their services are all over the place, scattered about. Immunizations is still here, but most everything else has moved out. But if you want to know where those services are located, go to buncombecounty.org or call 250-5000, and there you can get the most up-to-date information about where those services are. So we also want you to tune in next month, because that's going to be an exciting show. We're going to learn about the Life Safety Tower. That's something the county's building on the back of the courthouse, and we're required to build it. It's going to be a really neat addition, but it's going to change the face of downtown. That and some more stuff. We're going to talk to John Creighton. He's going to tell us about that. We're also going to hear about some services that are currently in the courthouse that are going to be moving here to 35 Woodfin Street. That's going to impact every single one of us. So if you want to know, stay tuned, tune in next month. I'll see you then.